first, we're going to go to a case update, and we're going to put that on the screen so that you can see it while I'm talking about the case updates. That's where we are. So today in New Mexico, we've got 1,484 cases, as you can see. We are reporting an additional 80 new cases today. We've got 90 individuals who were hospitalized, 22 on ventilators. Remember why this correlation is important, because when we're looking at the capacity of our healthcare system, we're really clear about how many beds, how many critical care, how many ICU care, and how many ventilators might be needed. And so that's a really important ratio. I want to tell you that today we're below the ratio that we're seeing around the world and across the country that typically has about a third of the individuals who were hospitalized at any given time on ventilators. I think it's too soon to say whether we're going to be always underneath that ratio, so that might reflect, even with bending the curve, that we won't need as many. But I just want you to know why we provide that information and why it's so critical to the medical community. Good news today, we have not reported any new New Mexico deaths. Terrible news that we've seen a spike in the number of deaths. We have 90 total, I'm sorry, we have 36 total deaths. I gave you the hospital number again. We'll put that back on the screen, 36 total deaths in the state. And as I say all of the time, and should, my condolences to all of the families. It is difficult enough under any circumstances to lose a loved one. But when you can't say goodbye to that loved one or have your family together for a funeral or celebration of life, that pain, quite frankly, is just unimaginable to the rest of us. And it is hard to report on that statistic each and every time, but it is important for the state to know what's happening and whether or not, in fact, we're doing everything we can to save lives. And before I do kind of a general report, I think it fits better to actually go right to Secretary Kathy Kunkel of the Department of Health and to talk about testing, how many tests, where we are, what's going on, and then she'll hand it back over to me. Secretary?
Thank you, Governor. Good afternoon, everyone. Testing continues to expand in New Mexico. We have tested 32,850 people to date. We have, as I've said before, 60 sites operating regularly across the state in all 33 counties. In addition to those regular sites, we have focus sites, and I'll talk a little bit more about that. But if anyone should have problem reaching one of our regular sites, please remember to call your public health office, and they will make sure that you are tested. Our lab capacity continues to expand thanks to our private and public partners. We have some new partners this week. We are now able to process up to 3,500 tests a day, and we will continue to expand that in the coming weeks. But we welcome this week National Jewish Laboratory from Denver, Colorado, who is taking specimens for us and processing them in 24 to 48 hours. We welcome Sandia National Labs, who is able now to test federal employees and is entering into a contract. There's some federal paperwork that has to be resolved, and they will be able to test other New Mexicans. We welcome Walmart, who has reached out to us and entered into a contract should we need their support. They are also expanding our capacity. And this week we have the Abbott Rapid Point of Care testing around the state. Both IHS and the state lab received point of care, and we have distributed them cooperatively in rural hospitals around the state. And there are some other point of care testing capacity at some of our rural hospitals. So with that expansion, we have been able to go beyond just routine surveillance in our test sites, and we are focusing in a comprehensive planned way on long-term care and tribal communities. And by saying we are mapping them regionally and going out and testing in surveillance and or in response to a positive. One of the other new developments in the last week is the opening of Canyon Transitional, which I believe the governor will be speaking to, or maybe Dr. Scraves, but this is a long-term care facility that has cooperated with the state's need to separate positive individuals from long-term care and healthy individuals in long-term care, and this is a very, very important development in our strategy. So we're grateful to all of our public and private partners, and we will continue to test as broadly as possible to limit the spread. We thank you all for continuing to help us by limiting your face-to-face interactions. Thank you.
All right, off with my mask. Thank you, Secretary. I really appreciate that. I do want to focus a little bit on our general effort to deal with high-risk populations. So basically, states, because they have limited access to the supplies that you need to run laboratory tests, and many other states, quite frankly, don't have the same kind of partners or laboratory instruments. And New Mexico being a significant research state, we have access to a wide variety of laboratory instruments. Frankly, we have also incredible molecular biologists in the state, and that environment allowed us to get testing ramped up and ready to go faster than most states. And if you look at where we are in terms of per capita testing, it's still really good. But it is not good enough, because until we can test everyone, it's not good enough, because you can't see the prevalence, you don't have good surveillance, and you can see that it's a national challenge. And I'm going to talk a little bit more about that, because I think New Mexico is in a position to, and we should, to lead the country in strategies that will allow for a federal response to surveillance. But what we can do with that opportunity is to leverage our supplies and our capabilities and go to high-risk areas. So we're doing surveillance at nursing homes. We're looking at places where we've got folks who require 24-hour care or support, and we're engaging in all of those facilities statewide. Can we get them all done in one day? We can't, but you should be seeing your Department of Health and the state working with our partners and getting that done in a number of communities. And our goal is to get it all done as quickly as possible to prevent having the kind of issues or outbreaks where people, quite frankly, lose their lives because they're in the high-risk group. That's why the Canyon facility is such a dynamic and important idea. It is not a perfect solution. Moving anyone with COVID-19 poses risk. Leaving folks in a nursing home or 24-hour facility where their staff continue to get sick, they're understaffed, and that virus moves through the highest risk population, unfortunately resulting in the deaths of far too many individuals, is also unacceptable. So this idea is getting national attention because it might be the right bridge. And I want to just point out, it's not a perfect bridge. In dealing with these public health emergencies, and until we have a vaccine, you have to do the best evidence-based effort, and you have to be willing to continue to evaluate what's occurring. So for the families who are involved in that, and the geriatricians and the experts, we are very grateful. And I am cautiously optimistic about how well this can work to manage spread and to protect nursing home in particular, but any 24-hour care resident anywhere in the state. And in talking about nursing home residents, I want to do a little bit about Easter. I want to thank everyone. I joined many New Mexicans all across the state who visited their loved ones in a care facility of some sort by doing it outside with a do-it-yourself mask and maybe gloves, delivering candy or flowers, but doing that visitation through a window. I did that. It was great to see my mom, and she's doing fairly well. It's tough being separated, but I did that visitation, and it just is a reflection that people made sacrifices all over the state to do incredible social distancing, which, as we all know, is critical to protecting our first responders, our healthcare system, and saving lives. And so we're going to keep doing that. You probably noticed that the day before Easter, I declared through the Department of Health, Secretary Kunkel, an additional order not excluding our churches from mass gatherings. And we did that because we had more than a handful of churches who were going to have Easter services, and knowing the risk that poses to all of our communities and our healthcare workers, we made that an explicit prohibition in the order. I'm very pleased to report that without the order, most of our faith-based communities and churches were finding ways to live stream their services and reach out to their members and their congregations, and I am still very grateful for that. I think we only issued one cease and desist on Easter Sunday, and given what I saw around the country, that says a lot about the leadership and dedication of New Mexicans and our faith-based community, and for that I'm incredibly grateful. In addition, you've probably seen that we have a Supreme Court ruling related to our upcoming primary in June. And why is this important while we're giving you an update? Well, everything we do is focused on what strategies we're undertaking in a public health crisis. And we know that polling places will pose a difficult situation where people are congregating. This is how the virus is transmitted, person to person, and even with distancing. And even with do-it-yourself masks and protection for poll workers, it's still a risk. I appreciate that we don't have all the powers that many states do to change their election strategies, but the Supreme Court was really clear about making sure that the Secretary of State, whose courage and leadership is to be commended in this environment, she's looking at addressing both a public health emergency and making sure that our privilege to vote is not minimized in any way. So I want to ask every New Mexican, you are going to get automatically mailed to you the request you must make for an absentee ballot. An absentee ballot is the ballot that you receive also in the mail, but only if you request it. Here's the nuance there, right? We're not doing a mail-in election. You have to request an absentee ballot. In this case, you have to respond to the mail-in notice by the Secretary of State. Please, for the sake of all New Mexicans and dealing with this public health emergency in the most meaningful way, watch for that mail notification, request your absentee ballot, and then fill it out and mail it back. That is the only way we're going to manage this and minimize the number of folks who only have as an opportunity to vote, to cast their ballot, to go to an actual polling site. So thank the Secretary of State and many other clerks around the state for their courage at dealing with this public health emergency, making sure that we're timely about protecting people's privilege to vote. Please, please do an absentee ballot. All right, what have we gotten done? Well, those are two important aspects about faith-based communities, social distancing, making sure that we know what's going to happen for our primary election. But we are also really ramping up the delivery of food in the state. And so a lot of eights in this presentation. 80,000 pounds of food has been delivered to the Navajo Nation. 800 boxes has been delivered to San Felipe. And then enough food has been delivered to Isleta to feed 800 children. Why is all of that important? Because as people are sheltering in place, if we're minimizing the spread, where we've got high-risk populations that we don't want moving, traveling, and in the Navajo Nation, where there isn't access to food or water within a 100-mile radius, we have to take the responsibility to provide those necessary items to these New Mexicans. I want to thank the National Guard and the food banks and all of our partners who are making sure that we are getting that done in a meaningful way. I'm incredibly grateful. All right, I want to show you some other wins. I've been promising that we've been very aggressive on personal protective equipment. I hope you saw the video that we released. I think it's important to see both how much layering our healthcare workers are required to wear to be safe and to make you safe, and that it's an incredible amount of personal protective equipment, and not all of it can be re-sterilized. Not all of it can be re-sterilized forever. You have to have large quantities. So the respirator masks, what we call N95s for healthcare workers, we just got in 200,000. Surgical masks, which look an awful lot like the mask I was wearing. We got 1.3 million in, and the plastic face shields, right, that are the further protection to make sure that we are protecting your entire face from letting that virus get access to you. 50,000. I also want to show you what we're expecting shortly. These are significant pending orders, and I want you to know this does not reflect by any stretch of the imagination, literally, the hundreds of orders and the effort that it takes by folks in state government and in the National Guard to work to get these supplies in. It is maddening, and it speaks to not having a federal strategy to do this. We've got 400 ventilators that we believe will be here next week. That does not include, and if you're looking at this chart of these bullets, you can see that 1,000 are requested through FEMA. So what's the difference? 400 is what we're going after independently. The FEMA are orders that the federal government is helping us with. The reality is it's not one or the other without a strategy, it's both. We have to have both. Now look at where we are with the N95 masks. We're looking for 1.5 million more to come in next week and another 600,000 gloves. I wanted New Mexicans to see that we are having success. We are really on this. Is this an assurance that there will be no shortages or difficulties anywhere in the state? No, it's not. But it should give you great confidence that we are taking nothing for granted. And our frontline healthcare workers and our first responders and our food deliverers and preparers are getting what they need to stay safe, keep patients safe and served, and to keep everybody else in the state from being at risk of catching this infection. So I feel really good about that. I want to thank the countless New Mexicans who were involved. Now, the last thing that I want to say, and we're trying to give a lot of information in a shortened amount of time. We'll go right to modeling after this with Dr. Scrace, but I'm really pleased to announce that it looks like, it's a little premature to confirm it all, but we had a very productive conversation with the White House this morning. And in my conversation with the White House, it's a team that is really looking at if we're going to deal with this public health emergency productively. It's not either or. And you want to talk about economic recovery. And you're seeing states that are now coalescing together, right? So we've got the northeastern states that are working as a region. You're seeing the West Coast states working as a region. Of course, your western states. I was on the phone with the governor from Colorado, Jared Polis. We're working at like strategies so that we're testing them, we're evaluating them. Businesses that are exactly the same in either of the states can get the same kind of support in a meaningful way. But it is not an either or. You must keep addressing your public health crisis. In order to do that, you have to have massive testing. Really, you're doing public health surveillance. You know unequivocally what the prevalence of this infection is. You have to have a vaccine, and you have to have a treatment protocol. That's what the federal government has to be pushing. If they do that, then this state and all the states in the United States can really work on an economic recovery plan, which is critical because the rest of it is getting done and the public health emergency is being addressed. Well, the White House is interested in working with New Mexico because of Secretary Kunkel's success in testing and because of Dr. Scrace's success at getting our medical team ready, bending the curve, and addressing the public health emergency. They want New Mexico to be a pilot for surveillance and research and what we call contact tracing. That's figuring out a more automated way and bringing in more workers to figure out who has been exposed. These are the ways in which we can address this public health emergency and meaningfully address economic recovery. And I'm very proud of the opportunity to get to work directly with the federal government, lead the country in these responses, and also protect New Mexicans during this public health crisis. So we'll give you more information about that as it develops. And now I'd like to go to Dr. Scrace to talk about modeling and what we're seeing in the results of our social distancing. Thank you, Doctor.
Thank you very much, Governor. Before I get into the modeling, I'd like to present two resources that I think can be useful to many, if not all, New Mexicans. The first is there's a new app out called NM Connect, and it offers resources for people with behavioral health issues during this time. And we know this is a big change, excuse me, for people. And you can download this app, NM Connect, and it's got phone numbers you can call 24/7. It's got additional resources for recovery, COVID information, and community resources as well. So I encourage you to take advantage of that. And then the second is the DOH has expanded their reporting on the website here. And if you go to the usual cv.nmhealth.org site and scroll down a little bit, you'll see a purple box that takes you to this map. You can hover over it. You can look at data from every county for the whole state. It has data about testing. All the data we're presenting here to you today, actually, almost all of it you can get on that website. So it's a great resource for everyone in New Mexico to see what's going on. With that, I want to talk a little bit about what we're seeing in the state this week. And if we could get the first slide, it's a map of New Mexico. We've taken off the numbers to make this easier to understand. And basically, the darker the county is colored, the higher percent of people in that county that have had a COVID infection. And so you can see again, and now darker than last week, that northwest corner of the state, San Juan, McKinley, and Sandoval counties are the darkest counties. Now, I do want to give a shout out to Santa Fe County. Their curve is really flat. They've had, I think, 76 cases, but not really growing. And I think we believe that there's some really effective social distancing going on here in this county, and really pleased to see that. I know state government is completely converted, or almost completely converted, to work from home. I think that's contributed as well. But you can see that data in the northwest corner of the state, and we are still seeing more rapid growth of cases there. On the next slide, you'll see a graphical representation of this. So what this graph tells us by week is the percent of cases, the percent of all new New Mexico cases, new cases, that have occurred in those three counties put together. And you can see yesterday and the day before, Monday and Tuesday, 75% of our new cases in the state have been in those three counties in the Northwest. And so we're keeping a really close eye on that. It's an important area of our state to watch. There's also additional information that is available online, but this area of the state has a higher rate of people with low income. There's less access sometimes to medical care, to food, to housing. And so it's a very, very vulnerable population. And so we're doubly concerned to see the rate of cases in this part of the state combined with these other social determinants of health and socioeconomic factors that may make people even more vulnerable. And so we're watching that closely every day and hoping to counteract that trend. The next slide will be a familiar slide to you. It's the slide about the doubling time. And just for those of you who haven't seen this before, doubling time is the time it takes from one point to the next for cases to double. So if you have 2 cases one day and then it's 4 and then it's 8 and then that's 16, your doubling time is 2 days. But we have done, through social distancing as a state, an amazing job on this. We're now up to 4.6 days for cases to double. They're still doubling. That's still really important, but we believe that the effective social distancing that everybody has been doing has really been what's made the difference in this. And so I wanted to thank everyone in New Mexico who's been staying at home. We know that's hard to do. The last time I was out of my house was at the press conference last week, other than taking a brisk walk in the neighborhood very, very early in the morning. And so I know that's difficult, but it's working. And this curve really is flattening. And that surge that we were predicting, those numbers are getting lower. The time is being pushed out a little bit to give our healthcare system more time to react and get ready. And then the last graph, rather than giving a report card today, I wanted to show you how we are getting this data from Descartes Lab on the average number of miles people travel in New Mexico. We mentioned last week this doesn't include journeys of 50 miles or more, but you can see the curve is the lowest on Sunday, then it always goes up on Monday, and then gradually comes down Tuesday, Wednesday, Thursday, and Friday. And so you're looking at the past 4 weeks, and you can see that gradually New Mexicans are traveling less and less. We'd like to get down to a 60% reduction, but we're at about 45. And I wanted to especially point your attention to the very last point on the graph. That's Monday, day before yesterday, the lowest Monday since this pandemic came to New Mexico. So just congratulations to everybody who's working to stay at home. I think we're seeing a easing up of the rate of increase in our cases. The surge is going to be a little bit later, and that keeps healthcare workers safer. But thanks again to everyone in New Mexico for your contribution to improving this. And again, we'll continue to watch the northwest corner of the state. You can watch it on the website with us, and we're working to make sure we have all the necessary medical resources either in those counties or systems in place, which are now in place, to transfer people to a hub hospital if necessary. Thank you.
All right. While it's difficult to talk about that we have new cases every day, difficult to talk about the fact that you saw that, you know, in the last several weeks, we've got a 75% increase in areas that around the country that call those epicenters, which are very difficult areas to both continue to protect and support and to make sure that we don't see that move throughout the rest of the state. And of course, those high-risk areas do impact what we're projecting will occur in hospitals. Right? Every time you have these kinds of transmission issues, then we've got more risks to healthcare workers. But I also think it's important that by and large, New Mexicans are working really hard. None of this is easy. The app that Dr. Scrace described, NM Connect, is really important. We know that there are many issues that are exacerbated by not being able to have social interaction, to have direct access to your health care or social services providers, that not connecting with your family, not connecting in a way that is more personal with your church and faith-based organization. These are all issues that are not insignificant, they're significant. And so we think it's really important to also tell New Mexicans what you're doing is making a difference. And we are grateful. That is not permission to ease up. Our goal is to continue to still save lives. And I will tell you that given that the risks here for transmission arguably are a bit lower because we're bending the curve is another reason we are in a perfect position to partner with the federal government to do surveillance because we've mitigated risk. So we get to address the public health emergency and we're mitigating risk. So job well done. It won't be enough until we deal with this public health emergency in its entirety and we figure out what the new normal for New Mexico is going to look like and how we all support each other to achieve that. So I want to thank everyone who continues to tune in and who is helping us bend that curve. And with that, Nora, we are ready for questions.
Thank you, Governor. First, we are going to go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question. Matt, go ahead.
Yes, it took me a second with the delay.
For questions.
Governor,
Go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead, Matt.
all right, thanks, Nora. I'm wondering with the staffing, you talked about getting nurses from Canada, something like that. I'm racking my brain, can't figure out why someone would want to expose themselves and come down here and sort of deal with that. So I'm wondering about that. Also, in terms of contact tracing, you mentioned that you want to hire more people. Who are you hiring? Can people who are out of work in New Mexico apply? And if so, how? Thanks.
Yeah, well, thank you for those questions, Matt, and I apologize for the technical difficulties. This is harder to accomplish than it appears, but I'm grateful for everyone who gives us this support and for the patience by everyone who's trying to ask a question. On the nurses' side, we don't have them here yet. It requires one more approval by the federal government, and while I pick on them and will continue to do that because they need to get all of these operations up and running, it is difficult sometimes to get what they will identify as lower level reviews. With the stimulus money that's coming in, the second effort that is before Congress, the economic recovery plans, and any number of other issues, including continuing to ramp up, and we aren't there, domestic manufacturing of personal protective equipment and testing supplies. Here's why they want to come. There is no healthcare workers that I'm aware of anywhere in the world who aren't willing to stand up and help. And where you've got places that have significant shortages of healthcare personnel, Or, as Dr. Grace has talked about, too many of our healthcare workforce are, 60 years of age and older, both working and, those retired are at the older end of that spectrum. It puts us in a high-risk situation. I think it's fairly earnest about wanting to make a difference, and there are plenty of countries where folks do want to participate meaningfully in the United States and New Mexico's healthcare system. So that will happen. I wish I could tell you exactly when. I can't pinpoint it. It's the kind of stuff that I'm dogging the federal government all of the time about making sure that happens. However, with regard to personnel, when we get these hospital supports, right? So we've got the 50 bed supply effort that's in Farmington. We're working on one for Gallup, and we've got, I've been reporting it as 200. There was someone on a phone call with the White House that said 250 beds. So I don't know what it is, but I did have a conversation with Vice President Pence yesterday, and they assure me that that is on its way. And I think they might be referring to getting it packed up out of Washington state, so that's why it's not done, and moving it to New Mexico. That's what's happening with ventilators and a lot of these hospital units, and they come with staff. So part of not getting it addressed in Health and Human Services and CMS getting those decisions and waivers is also reflective of they are spending their time and attention taking things apart and down in one state where they don't need it anymore and moving it to the next state in the queue. So that's what's going on, and that's where a lot of our staff are going to come from, although I do think we're going to get some additional public health staff support, and we have additional National Guard health support, and I don't have all of those numbers because all of the requests have yet to be met. And I think that's something I disagree with the federal government. Their basic rule of thumb is we're going to get it all to you within 72 hours of needing it. Like this, in emergency preparedness work, that is cutting it too close. And we're pushing to get it all ready early. We can test it, we can support it, we can visualize it, we can practice our response. So my job is to keep pushing, but I have a very high degree of confidence that it's all coming. Nurses may happen at the end of this public health crisis in terms of our surge and our peak. Now, the contact tracing, look, we do a lot of that we're using some, certainly, database systems, but the reality is because we haven't had an epidemic or a pandemic of this nature, most states, including New Mexico, have pretty antiquated systems. So here's how it works. I find out that I've got a positive ID. I'm someone who's held in that confidential area in epidemiology and the Department of Health. I make a phone call, right? I make sure that I'm matching up the information I have from the test result to the person. I call you, I tell you, and it's an interview. And then we have more folks that contact everybody else that we think you've been in contact with. These large-scale applications help figure out basically within a certain mile radius of where you were likely to have gone and allow us to make contacts and ask folks to come in and get tested so that you're doing tracing in a much more robust way, which is really a much more effective response. There's a lot of applications, a lot of studying going on, and now we're going to be in a pilot area to make the best decisions for New Mexico and to do them early. You still need bodies. And yes, we think that this is a meaningful work where we could hire some of our individuals who are unemployed. It's not going to be the kind of work that everybody wants to do or is qualified to do, but I think it can help. And I'll just give you a sense. When they look at it from a national context, it's tens of thousands of workers. So in New Mexico, could be as many as 1,000 workers who would help us in those first phases of surveillance and contact tracing. So yes, and we're really looking forward to being in that pilot seat with the federal government. Dr. Grace has a follow-up.
Yeah, just a couple other ideas about workforce that we're working hard on right now. Reminder that social distancing is the #1 way to reduce the number of people we need to take care of COVID patients if we have less people getting the disease, but we are working with our licensing boards to expand the ease of licensing to get people in from out of state. We can use teleconferencing and Project Echo to train people as a force multiplier to move people from one area where they had been working to another. I know my wife's an oncology nurse, and in her organization, they are retraining staff to go to the inpatient side, and they're training floor nurses to work in the ICU as well. And so there are some areas that have less activity right now, and those staff can be trained as well. We're working with retired emergency physicians and pulmonary physicians to move them also into a situation where they can be doing teleconferencing with ICU doctors and ER doctors to help them in rural areas. So lots of things going on. We're having regular meetings with hospitals, with Primary Care Association, Medical Society, and others to make sure that everyone's ready and prepared.
Yep, Secretary Kunkel, this is why you have experts with you. No,
And I just want to say to
meaningful.
you, to Matt, to your question of why would nurses come here, the Department of Health has always managed the Medical Reserve Corps, and we had an increase, I think someone told me, of 1,000 volunteers once this started. So people are stepping up.
Yeah.
Thank you, Secretary. Next question, Nora.
Thank you, Governor. All right, folks, now we're going to go to Algernon with the Las Cruces Sun News. Algernon, if you want to turn your audio down, and I will unmute you right now. Algernon, you're unmuted. Go ahead and ask your question.
Thank you, Governor and Secretaries. During the week, as I know you're aware, some business owners as well as the state Republican Party have raised some questions about why smaller businesses can't operate under some tailored public health regulations that would allow for specific conditions in specific counties. And of course, no policy can really account for every situation, but are there sort of plans to try to apply some more sophisticated or even some more localized measures that would allow some businesses to stay afloat, whereas perhaps some big box businesses have a competitive advantage under the circumstances?
So the big box competitive advantage is troubling for everybody in the country who's trying to make sure that their local small businesses can, to the highest degree in a public health crisis, stay afloat. And it is not easy. And the financial strains and struggles of these businesses and of the communities who are also affected are real. But if we're not at the surge and we're bending the curve, even smaller groups are still transmitting the virus. The notion that if you've got risk at one place, it's fair to have risk at two places is not an effective strategy when you're dealing with a public health emergency. The virus is not fair, does not care where humans are in contact with other humans, and we continue to restrain the number of individuals and meter in the big box stores, and the only reason they stayed as essential businesses by and large was because people do need access, right? Construction that makes sure that our wastewater systems are intact, that we can still travel on our roads, that our internet will be up, that our roofs will be whole. We have to have that, and you have to have access to food. So when you look at, right, the life and safety needs of an individual and a family, that's how we make these very difficult decisions. I would say that if we aren't really clear about our public safety requirements, that would be something we could look at right now. And you can't do it piecemeal. If you're doing it piecemeal, it's only a statewide strategy that creates the protections that we need for our healthcare workers and our first responders, and reducing the number of deaths and risks in the state. It can't be done. Then the virus just moves. It doesn't care whether you're in a small county or community in terms of population or an urban center. It will find you. So the bending is because we've been so aggressive about making sure that social distancing can be met. Here's what I would say to the folks who are frustrated, and being frustrated, is there anyone in the world who isn't sympathetic about that? I am. It's really hard to see the economic realities of this public health crisis, that we are working on any number of strategies. So the surge, the peak, We have data, and now we're going to get data in ways that other states aren't going to have. That's a benefit to start thinking about what can we be doing? Where do you start? Do we take temperatures of employees? Do we take temperatures of every person who comes in? What would be, the next group in an essential workforce? We should do that statewide. We should ease those pressures in a way that really looks at the public health emergency. So we are looking at that, but we're not seeing any benefit at all from having one community be different than another. Although, and I might get a question about this, you've got a couple of communities that are going the opposite direction, where they're creating more restrictions than we've made statewide. Because they're in epicenters, and they will tell you unequivocally that when you have rapid transmission, which occurs by people having contact with one another, it's very difficult to manage. So they're trying to restrict businesses and business access to individuals even more. So it's too early, and I wish it wasn't, but this virus is vicious. And we'll stay the course until we get to that peak or we have more information about that peak. And we'll do everything we can to get the federal stimulus money out to these businesses. I am seeing some relief through money that's getting out through our community banks. Thank you, community bankers. I have to do both, protect the public health and recognize that we're in dire straits and we got to get as much money out and then start to open up our economy. Next question.
Thank you, Governor. Now we're going to go to Ryan Laughlin with KOB. Ryan, if you want to turn down your audio, I've unmuted you. Go ahead and ask your question.
Thanks for the time. Governor, I want to ask specifically about nurseries. You addressed some of the big box issues, but what about nurseries? We're seeing that garden centers are opening up in Walmarts, Lowe's, but a lot of the mom and pop shops are getting cease and desist orders, even though they're trying to implement social distancing. Is this an example of where there needs to be some more clarity on how we're regulating what is essential business and what is non-essential business?
Well, again, I'm sympathetic to the nurseries, but I'm going to do two things. No one wants to hurt businesses. No one wants to hurt local businesses. And New Mexicans are ready to have some hope, right, for spring and summer and planting and supporting a local business. And if I'm going to be isolating in my own home and backyard, these are really important things. And people grow food. I grow tomatoes. I understand it unequivocally. But the comparison between a big box and the local nursery and everyone trying to find more and more and more exceptions to the public health orders flies in the face of dealing with this public health emergency. We're trying to have less transmission and less exposure, and we restricted the big box stores because we saw that there was not social distancing occurring there, and I said I would take even further measures to try to restrict access if we aren't bending the curve. We do think that there may be strategies to work with local nurseries, and we're absolutely open to doing that. So here are some of the same ideas that we've deployed for other businesses. Let's see if we can't help them do internet sales, curbside pickup, or delivery, and some of them are going to have resources to do that, some of them aren't, so we have to figure out ways to try to address that in the most meaningful way. And for those small businesses who are anxious for us to take a look, we are taking a look right now, and they should expect to hear from us. It's been a really tough, busy week, and we haven't had as much time to do that, but we think it's an important thing to do. We are looking for fairness. We don't want to hurt small businesses where we don't have to, but this is not an either or. I have to do both. I have to deal with this public health crisis and keep trying to keep folks at home. And that means that we're restricting access to any number of small local businesses. We are pained by it. And I do appreciate that they've been reaching out, so they should expect to hear from us. We have a couple of ideas that I hope will bear, pardon the pun, fruit in short order in the next day or so. Thanks for asking the question. We appreciate it.
Thank you, Governor. Next, I'm going to Brandon Evans with KOAT. Brandon, you are unmuted. Go ahead and ask your question.
Well, good afternoon. I want to talk about the model that the University of Washington has come out with, and people have been using it a lot nationally. Back on March 30th, it estimated that by August 4th, New Mexico was going to have 500 and some odd deaths. Well, today, the latest model has that number down to 155. So do you think that has been a direct result of what you guys have done? And do you still think that that model is underestimating the impact?
So last part of that question first, and I'm sure Dr. Grace is going to want to weigh in because he's leading the experts around the state about modeling. So we still think it's too low. I wish it wasn't. Look, the best news ever is if New Mexico is so successful that there are no more deaths in the state and that we really managed to stop this infection. That is the best news ever. And yes, there are economic consequences, there are educational opportunity consequences. There's been any number of that. That's happening worldwide. It's not like and I know that that's not what you're saying. It's not just happening in New Mexico. This virus is blind to all of those other consequences. But most, if not all, of the states have rejected the Washington state modeling because it used a point in time when there were no cases identified, didn't use the right modeling strategy. And I will tell you now, I don't think even the White House is using that modeling, which is, I would say, why they're interested in coming here. But yes, they're also interested in coming here because we can see what bending the curve really looks like in terms of infection prevalence. So it is not the right model. We don't believe that at all. We think it is way too optimistic, and going more optimistic doesn't work, is inconsistent with what we believe and the number of deaths we have so far. And you've seen an increase in the number of deaths in the state. But again, we would love it if we have not one more single death in the state. We don't want to win on modeling that looks like there's more public health consequences. We want to win on modeling that indicates that everything we do is having the right impact. But again, this is modeling that hasn't really been accepted for any state who's using real state day-to-day data to identify where you are at any given point in time. Dr. Grace.
Thank you, Governor. The modeling team meets every Tuesday at 1. We have over 25 experts in the state. Folks from our national labs are on that call every week. We look over our own model and we look over all the other models. We look at what's happening with the Washington model and others. One of the problems with modeling is sort of like buying a car. If you went to buy a car and they wouldn't let you test drive it, you probably wouldn't want to buy the car. And we need to be able to put our own New Mexico data in. We talked about social determinants of health. Those are in our model. We talked about burden of disease. That's in our model as well. Every day when we have a different doubling time, the data that goes into that doubling time goes into the model. And so we still believe it's an underestimate. Again, we'd be very happy if we could get those results. We are seeing a downward trend in our forecasted deaths like the Washington model because of the social distancing and because of the slowing of the rate of increase of cases. But we're looking at 5 or 6 different models every week, but the one that we can actually put our own data into and change, and actually the model on which the curve actually bends is the one we're using in New Mexico.
Right. And I might just add one more thing. The Washington model really, because they didn't look at any of the unique issues that we have in a rural and frontier state, or the multicultural issues that we have in the state. And if you look at what's happening in those counties, and Sandoval and McKinley and San Juan County, and if you look at the cultural diversity issues that we might find scientific and medical data that could indicate that there's a genetic predisposition even, none of that data is engaged or identified as part of the modeling for the Washington state data sets. And so just that alone shows that it's skewed in a way that didn't take into consideration any of that. And we're seeing that We thought that that would occur. We talked to New Mexicans about that early. It's not something we wanted to occur, but in fact it is playing out, unfortunately, in the way that we thought those risks likely would. Next question.
Thank you, Governor. Next, I'm going to go to Dan Boyd with the Albuquerque Journal. Dan, you are unmuted now. Go ahead and ask your question.
Good afternoon, Governor. Thanks for the opportunity to ask some questions. There have been some reports this week about hospitals laying off or furloughing employees, especially in rural parts of the state and in urban parts as well, which seems paradoxical during a pandemic like this. But want to see your response to that and kind of what's being done to maybe assist those hospitals during this time.
So thank you for that question. Yes, I am. I think it's an interesting paradox, and it's one I'm really disappointed by. I'm going to tell you three things that are difficult to say, but I'm going to say them nonetheless. One, it is fact that because we won't allow anywhere in the country, New Mexico included, and this took courage, I would make the same decision again, which is you tell hospitals that they have to be prepared for the emergency surge and peak, which means I have to have more hospital space and capacity and more ICU capacity. I have to have every ventilator, which means your surgical sites and outpatient sites and gastroenterology clinics. All of that has to be available if you need it. And of course, the best result is if you don't. But if you need it and you don't have it, you're in real trouble. So we said no elective surgeries, and that's a very broad thing. I know that a lot of people around the country think that, that might be, they have a very narrow view of elective surgery, but it could be reconstructive surgery. It could be a colonoscopy that's not an emergency, that is a routine colonoscopy. Those are all deferred until we get through the surge and the peak. This is where hospitals, by and large, and I'm going to defend them, make money. These are the places where, right, you don't have long-term, high-cost emergency room, ICU, hospital beds that don't make money. This is the balance. And so that's fact. They're right. And that's happening all around the country. Everyone made that decision because you can't have an emergency response plan. Fact number two, that because they are places where hospitals can count on a profit, that what they're doing nationally, in my opinion, and I would say that was confirmed by a conversation I had with a leading large private hospital CEO, that what they want is a guarantee on their profits for the year, given that they could have done all of those elective surgeries and procedures. And quite frankly, I find that to be appalling as we address this public health crisis together. Now, we put out $30 million to hospitals. It's not enough. I mean, just to get New Mexicans to get their head around how expensive this public health crisis is. But it really goes a long way, and they're advance payments to what they would have expected through the Human Service Department later in the year, but it's an annualized budget, so it's meaningful right now. More than $150 billion is coming to hospitals. Can one make the argument that it's coming maybe a little late and without the right predictability? Maybe. But I worry that this is a national advocacy effort aimed at getting more money so that their profit centers are managed and maintained, and has little to do with protecting a healthcare workforce. I'm going to make very clear, I don't think doctors and nurses or any of the administrative and tech staff anywhere in the country are engaged in that, and I'm really disappointed that the hospitals in New Mexico behaved in this way, even though the financial day-to-day issues are in fact challenging, and the feds didn't give us all the monetary opportunities when we wanted them or needed them. We are encouraging our hospital partners to re-employ and to take away the furloughs and put everybody back on full-time as quickly as they can. And they should expect me to continue to have those very direct conversations with them about that. So yes, I don't understand it, even though I get the money part was hard. I do. And that's a fact. I don't want to defray or not recognize that that's true. But it really is a disappointing effort when I thought we were all in this together, trying to make it work, protecting our frontline health workers, protecting patients and their families, and saving lives. And let's hope that the infusion of cash that's occurring nationally and in the state begins to turn that tide and solve many of these problems. Do you want to say anything, Dr. Grace?
No.
Okay.
Thank you, Governor. Next, I'm going to go to Mayra Aguilar with Univision. Mayra, you are unmuted. Go ahead and ask your question. If you'll turn down your audio in the background, please. Thank you.
Nationally and in the state begins to turn that tide and solve them. Hello, can you hear me?
Yes, ma'am. Go right ahead.
Okay, so a lot of our viewers don't count with legal documentation or social security number. Many of them are not going to be receiving the stimulus check. And I know that there's other states like California, Illinois, Colorado that have programs that are helping these people with some resources. Are you, Governor, thinking of any plan or any program for a lot in our state?
So I really appreciate that question. We don't have a specific strategy that we're ready to either deploy or talk about, and I hope that that doesn't disappoint so many workers. Look, we want every worker back to work. I can tell you that I'm very clear that there is a huge economic impact just in food security, right? We need any number of workers and families who are able to get relief and to go to work, who are working in our long-term care facilities, who are working in our fields, who are helping us pick our crops and making sure that we're maintaining our own efforts in food security for not only the state, and it's an economic driver, but the nation as well. We will, as we are putting together our outline for economic recovery and trying to figure out what we do for as many of the self-employed individuals, right, who didn't get treated the same way. We now have, as part of the first stimulus benefit, we've got unemployment benefits that can go to the gig economy or gig workers, workers who typically aren't employed in the way that we think about unemployment or strategies to get stimulus checks. So there's plenty of holes that states are addressing, and I'll make sure that we're looking at those best practices, and you should expect us to put something out about what strategies we think would make the biggest difference. Every New Mexican that is unemployed is a New Mexican we care about. Thank you for asking the question.
Thank you, Governor. Next, I'm going to go to Chris McKee with CareQE. Chris, you are unmuted. Go ahead and ask your question.
Thank you. One of the questions I had was about clinics and hospitals. They've canceled a lot of routine screenings like mammograms, prostate exams, cervical exams to comply with the governor's orders. These screenings, of course, they help diagnose cancer. We wanted to know if there was any concern that this will prevent some people from getting a timely diagnosis, therefore sort of delaying treatment and affecting patient outcomes. Have any clinics or doctors expressed concern about this? And Governor, are you considering allowing these procedures to resume, considering that early detection is key, of course, in fighting cancer? Thank you.
These are some of the challenging risks as we deal with an unprecedented public health emergency. So any of those kinds of screening issues and any of those high-risk patients, there are patients who are cancer survivors that have to have more screenings than the general population just to make sure they're safe. If we've got a clinic or an outpatient group or a physician or a provider that is concerned that these orders are being too restrictive in the way in which they're being deployed by an HMO or a hospital or any one of our partners, there is nothing in these orders that precludes them from working directly with the Department of Health. And in fact, part of having a medical advisory team and the triage and all of the private and public sector partners is to make sure that you don't address this public health emergency, have these really sweeping changes to the way in which basic healthcare decisions get made, and then you create another set of problems. to my knowledge, and I'll go to both Dr. Grace and Secretary Kunkel, I am not aware that we've had a specific patient or group of patients problem. I would be surprised if there haven't been some unnecessary refusals or efforts not to do screenings in order to be ready for a surge and a peak. And if so, we would encourage all of those folks to come to us, because these are things that we can problem solve, and they should expect us to do that. I don't want to create more healthcare problems, as you suggested, on one end, while we tackle this incredible emergency health crisis on the other end. Dr. Grace.
Yeah, thank you, Governor. I was just going to say that I think when Secretary Kunkel issued the order, and we did clarify this, we're not attempting to tell doctors what is and is not medically necessary. And so anybody who has a high risk of a recurrence, for example, of colon cancer, who needs those sort of screening procedures, we are leaving that up to the provider community to decide that. There are other ways to screen for colon cancer that don't require a procedure that we could do in the interim. But I just want to make that really clear that while there were hundreds of elective surgeries canceled at some hospitals, there were hundreds of surgeries that continued because they were removing a tumor or a cancerous polyp or whatever. So it would be impossible for us to direct individual cases, and that's why we're leaving it up to our provider community, medical community.
Thank you. Thank you. Yes, and I agree with all that's been said so far. There is guidance on our website when you look at the public health order specifically related to this, where we helped physicians, clinics, and other clinicians make those decisions. And I think it was fair and well thought out. It came from the American College of Surgeons and some other associations. But even on top of that, I think we've had maybe a dozen calls where we have problem solved with physicians and clinics on those questions.
I appreciate that. So if we have folks who need further guidance, please call us. We don't want patients not getting what they need. We also want to maintain that we are holding in this pattern to be as prepared as we can be. We're trying very hard to make those two things not mutually exclusive, and they're gray, which means we do expect healthcare providers to make these decisions that are in the best interests of their patient and recognizing this public health emergency. But if they need help, we have experts ready to assist in that decision making. And glad to know about the 12 and that they were problem solved. Thank you, Secretary. Nora, ready for the next one.
Thank you, Governor. Next, we're going to go to Morgan Lee with the AP. Morgan, you are unmuted. Go ahead and ask your question.
Hi, thanks for taking my call. The federal pilot that you mentioned here, can you tell us any more about which agencies, the DOE, CDC, that are going to lead it up on the federal side? And is it a singular effort here in New Mexico, or are there other states? Can you tell us those states? And then the only other request would be if you could provide the latest update on Pueblos and just infections, what's going on there in that, what you've described as almost an existential threat. Thank you.
Yeah, absolutely. So I don't know which other states. There will be other states. They are piloting this effort and didn't tell me where. It might be because I think those calls were today. I could not even tell you exactly how we were selected. It is clear that the CDC and folks from HHS directly will participate in the pilot. I think that Ambassador Birx, who I think a lot of New Mexicans will be familiar with because she's part of the COVID-19 White House Task Force and gives us daily briefings and updates about what's going on. It seemed clear to me that she would be directly participating from DC. I don't have any other details than that. It was a call to determine our interest. It was a call to tell us that they think that we have the capacity to ramp up testing, that we understand the testing and surveillance aspects that we've been doing without sort of these national strategies, effective contact tracing, and they think that we could ramp that up quicker. And I took all of that as very complimentary, and to your, I want to be careful about that, complimentary and recognizing that I have been pushing, and other governors have as well, that the federal government has to lead in addressing the public health emergency. It can't be state by state and region by region. It's exactly why there are so many frustrations around the economic issues, because we don't seem to be dealing with the public health aspects, which again, treatment, vaccine, surveillance, and contact tracing. If you can't deal with those four things, you'll just be on a merry-go-round forever. It stops, you get off, something happens, you get back on. You stop, you get off, something happens, you get back on. That is no way to attack this public health crisis. So I just don't have enough of those details, but I felt really good about the fact that they recognize we want to do that, and we'd like to help the federal government attack that as a national strategy. And as soon as we get information about that, we're happy to provide it to the public. But I have no idea yet. It just launched this idea with us this morning. And in fact, we are continuing to work with the Navajo Nation. I don't yet have the request from governors from Utah and Arizona. We're waiting on Governor Ducey. I've been pretty aggressive about help finish up that part of the letter, but the federal government knows I want a regional response, and that that's supported by 2 other governors that recognize that that's going to be critical. We think by this containment strategy that we have at the chapter level and the messaging that's coming out of the Navajo Nation, that's making a difference. We're continuing to be concerned with what we see at Zia and Zuni, and while it looks to me like San Felipe is seeing some improvement, too early to tell, but I will tell you that the leadership by all of our pueblos and sovereign nations in terms of their own community containment, their work to remove folks where that is appropriate, because we can't do social distancing in a meaningful way or isolation is occurring, that we're looking at strategies in McKinley County that I think are, I'm sure that you're aware, but maybe the whole state's not aware, that local officials within their power have restricted more alcohol sales and curfews. They've put in place more curfews in those communities to really manage transmission issues. We agree that in those areas is meaningful, and it does in fact protect Zuni and then Acoma and Laguna, and that's what we're doing. And I think that is making a difference. But you did see the chart by Dr. Scrace, where a large part of our increases is still in those counties that have a higher than other counties percentage of population that is Native American. Next question.
Thank you, Governor. Next, I'm going to go to Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go ahead.
And what I might do, Julia, if you can stand me.
Thank you, Governor. I had 2 questions. The first also relates to contact tracing, and I apologize if you answered this already. I couldn't hear the end of your answer to Matt's question, but I was wondering how you would characterize the current efforts in terms of efficacy. And then I wondered if you could talk about future contact tracing, working with the federal government, if New Mexico is looking into any of the digital contact tracing proposals, plans that are being discussed.
I did address this, and I'm sorry that it didn't get to everyone. Yes, we are working with the federal government. We think having more automation, which really gets to larger geographic risks. So if I live in X place and I'm COVID-19 positive, what can we assume about the businesses, the contacts, the grocery stores, the gas stations, the child care centers, food delivery spots, all of that in that area that can help us do more of that and see where risk is. What we do now, and that's not to say that we do not have a database, we do, and that we don't figure that out, but a lot of it is person to person, right? Who have you been with? Tell me the members of your family, and in a protecting privacy, we make all of those contacts effectively through our epidemiology department, but it is clear that if we're going to be doing this with this pandemic for the next year while we're waiting for a vaccine, it's got to be much more robust. So the answer is yes. We are interested in all of these new applications. We are working with any number of states and now the federal government in selecting what we think will be the best application. So that effort has started, And we were announcing that part of the pilot is to also do that by testing some of these applications with the federal government. So I am optimistic, very optimistic about what that means, because it is directly related to our ability to do economic recovery. So the answer is yes and yes. State partners, federal partner, more to come, necessary for good public health work in the state.
Thank you, Governor. Next, we're going to go to Jeffrey Plant with the Silver City Daily Press. Jeffrey, you are unmuted. Go ahead and ask your question.
Governor, Secretaries, this dovetails with the previous question. When can we expect to get more specific geographical data regarding positive test results? Right now, it's by county. Is there a plan to issue information by zip code, for example? It would be helpful to know which specific communities positive test results are appearing in. And also, second question, there's a cluster of confirmed COVID-19 cases that began in late March among workers and possibly now the families of workers at the Chino Copper Mine, which employs more than 1,000 people in Grant County. Freeport-McMoRan, the mine owner, temporarily shut the mine down on Saturday and indicated it would work with state and local authorities to determine when it's safe to open. What's the state government doing to make sure it's safe for the mine to open? And what is the New Mexico Department of Health doing to mitigate the spread and monitor the situation among Chino mine workers?
Sure. So with we have been committed and still are. So I'm hoping day or so, but soon on the zip code data. Now I want to. We're going to do it. But I also want to really ask for everyone's cooperation, because when you put that zip code out, we have to be very careful that we aren't creating, right, the unwittingly personal identifying information, even when you get to a small village. Oh, well, there's only 4 families. I'm going to call them all and find out who's positive ID. So I just want to be very careful about that. That is a risk that we take very seriously. When an individual comes forward themselves, well, we have no problem with that. And, you know, when they give us the permission to confirm that, we have, or to talk about areas like the Chino mine where we know we've got exposure and a positive case. And so we are going to do it, but that's one of the reasons it's taken a little bit longer, because how we do that, we want to make sure that we've done everything we ought to be doing to both provide public information so you know what's going on and where it's happening, and both that we're protecting people to the highest degree. So it is close, and thank you for making sure that you remind us that we've committed to that. I appreciate it, actually. And thank you for being patient as that is moving forward. I'm going to go to the Department of Health about what they're doing specifically and kind of what happens when we get a company that asks us to come in and do more testing and surveillance, which is what we do. But I also want to thank the owners of that mine. Look, it is a hard decision to make. We don't require businesses to shut down that have a positive ID, positive COVID-19 case that are in our necessary business list for the state. And that takes incredible courage, and it means that they want people tested. They want to make sure that they aren't having anyone come to work before they give them a chance to see if they've got symptoms. So they're doing that. They're giving everyone an opportunity to think about self-isolation and distancing. I appreciate that. And there are mechanisms to really clean the operations. I would assume a mining operation is more difficult than many businesses, but doing that is really important, and then setting up a return to work protocol. So I want to thank them for taking that seriously, because, you know, I've seen some of my colleagues around the country say, you know, businesses were going to get these cases and the virus was going to spread. We've seen one state in particular where, you know, one of the country's largest pork producers is now shuttered. And the notion that they were always an essential business, that they weren't going to get that they were going to get the virus no matter what. So social distancing doesn't make a difference. Yes, it does. because they're getting groceries, they're going to the gas station, they're getting necessary medical supports, they're going to the pharmacy. Yes, it makes a difference. The fewer people, the lower the risk to essential businesses, and essential businesses that take that serious and do testing and ask us to do testing and to tell employees not to come to work when they're sick, help us in addressing this public health crisis. And I want to make sure they get the credit that they deserve for being proactive and doing everything that they can. And, you know, it's really hard when we have an employee, through no fault of their own, contract this infection. And so, Secretary, I'm going to go to you for specifics.
Thank you, Governor, and thank you for the question. When I described how the testing team operates, I mentioned long-term care and tribal communities, but we also have what are called focus sites that are hotspots, and we get the information sometimes from the Department of Epidemiology. But Chino Mine was one of the places that we identified as, quote, a hotspot, and the testing team of the Department of Health was there yesterday testing 100 employees. And typically we will go out first, we'll do the testing, we'll do follow-up, we'll keep coming back as long as we're needed. But the Division of Epidemiology will give advice specific to each case, much as the governor was describing, and we will send whatever resources we need to assist that community with their cleanup and getting back. So we have a long-term commitment to the Chino Mine area.
Thank you, Governor. Next, we're going to go to Scott Weiland with the Santa Fe New Mexican. Scott, you are unmuted. Go ahead and ask your question.
We will send whatever resources we need to assist that
yes, Governor.
With their cleanup.
Just heard news that.
Oh, I'm sorry, Scott. If you'll turn down your audio in the background. Thank you so much.
Scott Weiland with the Santa Fe New Mexican. Scott, you are unmuted. Go ahead and ask your question.
Yes, Governor. Heard news that Tricor has closed 6 facilities and reduced hours in 6 others. And you've mentioned that Tricor is very important in the effort to do the widespread testing quickly. So how is that going to affect the efforts to test Mexicans, more New Mexicans quickly?
Well, a couple of things. In this whole issue where folks are not seeing the same sort of revenues in any of our healthcare delivery systems, I'm really disappointed by those decisions. Not all of them are related to the COVID-19 testing, right? They do all the laboratory testing for their partners in the state for any issue that you would be testing for, including flu and any other respiratory illness. That's why we are diversifying. We have capacity right now to run at least 3,000 tests. And you heard the Secretary of Health say we can, I think she said 3,500, and we can get, I know, with the laboratory instruments and the efforts of the national labs, which have been sort of slow to ramp up because this is not laboratory work that they were doing before. So I don't want that to sound like a complaint, but rather it seems like you can turn this all on a dime. I assure you, actually, you cannot. And we want everyone ramping up. But this is exactly why having relationships with other folks who can run laboratory tests is critical, so that we never are subject to a slowdown, even when we've got bad weather or Easter weekend and we don't have enough people tested, or one set of instruments, their supply chain seems to get held up. Then we go to another set of instruments whose supply chain has been ramping up. So no wrong door. Again, I don't quite understand the specific sense they are not reducing elective surgeries or beds. I can't imagine that their testing work for the different hospital partners that they have has been minimized, but the individual financial aspects of the entire healthcare delivery system, just like every other economic sector, if you look at the economic side, have been impacted. And because I don't have the specific, I will get right back to you and work through our communications team to find out about that. But I'm not concerned about our inability to test as many people as we have testing supplies for. And in fact, I'm expecting a decision, which is a question you didn't ask, and I'm taking advantage of you, that when we got asked a question about what we're doing with our sovereign nations, we've been doing surveillance work, but we can ramp up testing there so we know exactly what's going on, and then can utilize any number of mitigation strategies, because the Indian Health Service tests themselves, and then they send those laboratory samples somewhere else, and then we don't hear about them for far too long. We believe that the federal government, in short order, and IHS, their national director, a fellow by the name of Michael Wayaki, has agreed with us, and we're very grateful for his leadership, that they're going to provide both the sampling mediums and the reagents, the stuff that you need to actually run the laboratory sample, that they're going to give them to IHS. IHS will have them here in New Mexico. Public Health, through the secretary, will stand up the testing sites with IHS. We can do many more tests. We'll run them ourselves. We'll know in 24 hours, sometimes less. Sometimes we can do it in 4 hours, depending upon the number of batches that are being run by which instruments in which labs. So long way of saying, I am not concerned about the impact on the number of tests we can do. I am always concerned when one of our partners appears to be reducing its footprint in our strategies to serve New Mexicans in this public health crisis. And we will do everything in our power to solve that issue in short order, directly with TriCore. Dr. Scrapes.
Just one additional quick comment. Thank you, Governor. Recall that there's a difference between where the specimen is obtained and where the lab test is run. And we don't actually want people going into the lobby of a TriCore facility and getting a COVID test there. We want them in their cars. I'm aware from, this is 3 weeks ago now, but the TriCore was setting up a specific lab site to do all their COVID testing where people could get it done in their cars. But I don't think that we would have any decrease in our ability to run tests, because we don't want people having them in the specimens obtained in general, wherever possible, indoors, but rather in their car.
Yeah. No. There you go. So not scripted. You got the same answer by two people on the panel. Not concerned about our ability to run lab samples at all. Always concerned about employees and healthcare employees in particular that are not working at 100% capacity, because we think it's an important effort for the state. And Secretary Kunkel wants to add something.
I do want to say that TriCore in Albuquerque processes the COVID tests, and I want to recognize them as an outstanding partner. We have added some additional team members for the reasons that the governor explained, but TriCore remains the best partner we've had.
Folks, I appreciate everyone's patience. I'm going to go to Richard Reyes with the Gallup Independent. Richard, you're unmuted. Go ahead and ask your question.
Good afternoon. I've got two questions that might be semi-related. The first question, the NCI Detox Center here in Gallup shut down this week, which is creating some challenges on how to take care of individuals who are too intoxicated to care for themselves. I'm wondering if you have any information about this situation or any details about possible solutions. Specifically, I heard the National Guard may somehow get involved in this. And then my second question, I think you might have hinted at this or addressed it, but I didn't quite hear your full answer. We've heard that the Army Corps of Engineers may be building more alternative care facilities in our area, specifically on the Navajo Nation in Shiprock and Chinle. I'm just wondering if you have any information on those. Thank you.
The answer is yes. So the National Guard is standing up, and I'm calling them, and this term could change. So it really depends on working directly with the Navajo Nation, exactly what resources they want and need at the two sites that you mentioned. So Chinle, and I've been saying Crown Point too, and Shiprock. So as that gets narrowed down, these should look like triage centers. So you could get drive-by testing, you could get a food box, you can get medical and healthcare supplies, you can get water. If there are other issues that need to be addressed for a particular household or a chapter, that they get addressed, that you have the right team members ready to go, because what it does is it's one-stop shopping, if you will, for any number of issues in this triage center. And it mitigates having to go to community to community to community to Indian Health Service site and to try to get those services. Because when we do that, we are just moving this virus with us everywhere we go. So we're really working hard to do that. And it is really hard on those families, right? Who are having to travel hours and hours every day for just basic needs. And that's exactly what we don't want, those added stresses. And it allows us to also address the public health emergency. So I'm going to call them a triage center with all of those folks, but you need people on the ground who put the food together and help with delivering supplies and who will bring the lab samples back to us so that we're running them in real time. That's going to be National Guard. The detox center, we talked about that a little bit last week, right? We have two issues. One, we have a COVID-19 positive individual who is there and then leaves because we can't make them stay. That requires a very specific, a quarantine order, or you have to be in a facility that responds to a specific court order for a mental health stay. So what we're doing is working on, and I think we're actually going to do it at that site, where we've got lawyers, judges, advocates, so that we're very clear about an individual's due process rights. And we've got to create what I'm going to call a secure, safe program/facility for individuals who need that service and who are also high risk or are known to have COVID-19. We've got to stop the movement by individuals. And to do that, we have to have a whole different structure in place. That is occurring. I know unequivocally that a team, including lawyers, were in Gallup yesterday, and a shout out. Now, this has been a very challenging set of circumstances, as you know, for the county and the city and the community at large. And we appreciate that they're willing to make tough decisions about managing this public health emergency. And the National Guard can play a role. They cannot be law enforcement. They are not judges and lawyers in the context of making quarantine decisions, but they can create kind of a safety and secure environment so that we don't unwittingly have people who need services, but who would leave voluntarily and create other public health risks. We think we can accomplish both, and we think we can do a better job given a more secure / where necessary quarantine measures, which is a legal standard requiring someone to be isolated. And we think we can accomplish all in that community. Secretary Kunkel, did I miss anything about Gallup?
No, thank you, Governor. We are sending additional teams out from the Department of Health, physicians and attorneys, to assess the situation, and I agree that is going to be our resolution. And we're looking forward. This won't be the only time we have to wrestle with this problem, so we're anticipating looking for sites around the state to prepare effectively for the people who need that kind of service.
Right, and I'm sure that you're aware in Gallup that the high school now has much of the equipment for a step-down care center, and we've got many hotels and other partners who are isolation sites in the community. It is one of those, hot spots. It's an area that requires significant all-around attention by local leaders, community members in McKinley County and in Gallup, and it requires the priority attention of our response teams, and we will keep doing that. We're encouraged by the leadership in the community, and while it is a hotspot and a problem, our job is to save as many lives and to make sure that we minimize the really tough impacts, which is why they were one of the focal points for the additional deliveries of ventilators. And we are clear about standing up that healthcare system to the highest degree possible, and Albuquerque, Santa Fe, Las Cruces, any place else where it's safe, transport can be made and should be made, is also part of the planning arrangement for every community, including Gallup. Okay, I want to thank our language signers who have been incredible. I know that Nico is up now and has turned into kind of a statewide rock star. Everyone who does sign language for us and is making sure that we're meeting the needs of everyone in the state deserves our gratitude and appreciation. I talk a lot. There's a lot to say and do, and I speak very quickly, and you're amazing. So I want to thank you for doing that and allowing us to share our appreciation for your efforts and your work. And I want to, again, we have a lot to be grateful for. We are bending the curve. We are getting the federal government to pay attention to this as a public health, national security, and health emergency issue that requires them to lead in a national public health response. New Mexico can help them make the right decisions and get the right data. And the quicker that occurs, the safer it is for our first responders and our healthcare workers, and the better able we are, and I am, to make decisions that everyone is hungry for. When can I go to my after school or my summer program? When can I go back to work? When can I visit my family member? When can I travel into another community in the state or to my family in another state? How quickly can we get enough money out into the state so that small businesses can not only just start that recovery, but think about ways to flourish in the next year? We have a long way to go, New Mexico. It was never going to be easy. It's still not going to be easy. But we are, in fact, saving lives. And we are going to create an environment where maybe this country can have a different public health response and be more prepared for the next public health emergency and pandemic. And for all those researchers, and for every expert in the state that has volunteered their time and effort, I thank you. New Mexico thanks you, and quite frankly, your nation thanks you. I appreciate everyone. We're all in this together, New Mexico.